what keeps pulling you back and keeps you centered and also sane, as a practitioner?
It can be challenging, but seeing that the work that you do, the good work is helpful. And we do have tough days, there's no doubt about that. And fortunately, in my desk, I've got a nice letter file.
Oh, yeah.
And when you have a bad day or have to break bad news to a family, and you know that their day is not going to be better after speaking to you, I'll go into my nice letters file and letters from parents, families, patients, pictures that they've drawn, cards that they've sent, and sometimes just 3 or 4 minutes of going over some nice letters from families can make you feel enough I need to go back and do the next patient, the next family, and it can be challenging, but again, how you treat them, how you break it to them, and how you deal with them. It's 5 or 10 or 30 minutes for me, but it's a lifetime for them.
Sure.
So making sure that they feel comfortable leaving.
Boy, you just hit the nail on the head, because I often try to describe what it's like to get a diagnosis for your children. I think it's different. Like, I've never had a diagnosis for me personally that really set my life in one moment in a different path, but I've had it for 2 of my children. Mm-hmm. And that moment where there's this sharp delineation when you're meeting about your child, there's something wrong, quite seriously wrong. And then you get an answer. But your life up until that particular intersection was one way. And then once we have a relationship with someone like yourself where you're given the news and more information and a path forward, your life's forever changed. And so the weight I would bring if I was in your shoes, it's like, sometimes these are very hard conversations where the life of the family is forever changed. And I don't know if there's anything you want to add to that, but it was just that moment, just such a striking thing.
I think when there is a very challenging diagnosis to deliver to a family, before I give it to them, I sit back and say, how would I want them to explain this to me? Mm-hmm. How am I going to understand this, explain this, and know where to go once I leave the office? Mm-hmm. Because, as I said, they walk out, I see the next patient, but for them, this is lifelong.
Yeah.
And how you relate to them, how you get them comfortable with the next steps is the difference between their really being able to thrive in life or not. And the more time and effort you spend with that and really connecting with them is important. And it can take some time, but as I said, a minute or 2 for us is hours and days for them.
Well, you hit the nail on the head. When you feel like your doctor really has an interest in your child or in you personally and has a little bit of that softer bedside, empathetic, yet professional and steady relationship, it makes all the difference.
There was a quote from Teddy Roosevelt who once said, "Nobody cares what you know till they know that you care."
Yeah, I'm going to make a plaque out of that.
But true, no, I mean, they have to. You really have to care for the family and the patient, and sometimes you have to get up close. Sometimes you have to hold their hand, and really look them in the eye. And sometimes you have to take a box of Kleenex with you.
Sure.
But if that's what's needed, then so be it. That's a small price for us to pay, so to speak. But yet a huge benefit to them.
The Full Exposure Podcast is brought to you by Metro Health, University of Michigan Health, and Dr. Peter Hahn, in appreciation of the creative and artistic visionaries who enrich our lives through cultural connections.